under attack, and as a midwife whose very job it is to subvert practices and systems that dehumanize, traumatize, and harm pregnant people and all individuals in need of reproductive health care. We as midwives are tasked with the work of upholding our clients' reproductive rights and choices in a system that was designed to degrade them. It is essential to this task that we question and understand the underlying systems of power, colonialism, racism, and patriarchy that our country and our medical system have been founded upon, including the profession of midwifery. If we see the work of questioning and dismantling systems of power as absolutely fundamental to providing safe care and being good healthcare providers, it becomes very easy to see the connection between the day-to-day work that we do here in our clinics, in our hospitals, and at our clients' home in the early days after they give birth, and the need for healthcare workers to come together to demand a complete ceasefire in Gaza that goes far beyond a 4-day pause and an end to the illegal Israeli occupation of Palestine spanning over the last 75 years. We must recognize the Israeli state as a powerful contortion of Jewish trauma into a highly militarized, violent, and oppressive state dedicated to the domination of Palestinian lands and people. The acts of unbelievable violence committed by the state of Israel against the people of Gaza right now cannot be seen as anything but ethnic cleansing, an embodiment of racism, patriarchy, and colonialism, forces that are harming us all in different ways and holding us back from an experience of collective liberation. I want to highlight some harsh realities of being a woman in Gaza right now. I'm not dismissing the real and painful experiences of all people who are enduring under the brutal conditions at the moment, but I think it's essential that we recognize war as a gendered issue. There are midwives who are among those who have postponed evacuation, putting themselves at risk to provide care to pregnant people and their newborns. There's an estimated 50,000 pregnant women in Gaza right now, with 5,000 of those women expected to give birth in the next 30 days. Each day, 180 people give birth at inhumane and degrading conditions. Women have been forced to deliver their babies in the streets and in overcrowded shelters where the risk of infection and the spread of disease is extremely high. There are C-sections being performed without anesthesia. A news article I read recently highlighted the story of a midwife herself who gave birth in Gaza via cesarean and soon after was forced to walk a half an hour through streets of rubble with her newborn in her arms in order to get home. I just went to a C-section today, and I just cannot even imagine how somebody would find the strength in themselves to do that. Another article shared a story of a pregnant woman whose family home was hit by an Israeli airstrike, killing her 3-year-old child, forcing her into preterm labor. The newborn, delivered on the same day as her martyred child, required a high level of care in the NICU. The mother ultimately had to leave the hospital to recover from her injuries in birth, not knowing if the hospital will have the resources to care for her baby much longer, or whether a bomb will drop on the hospital and kill another one of her children. Pregnant women have been among those murdered by the Israeli military airstrikes and attacks. Some are likely to be among the thousands still accounted for, trapped under the rubble that were homes, community centers, or healthcare facilities that once offered them some sense of safety. Other pregnant women have been killed before and during childbirth due to a lack of access to safe, essential prenatal care. Just 50 kilometers away in the West Bank, there are around 73,000 women currently pregnant, with more than 8,000 expected to deliver in the next month as the violence threatens to spill over. We have also heard reports of sexual violence that may have occurred since October 7th, committed by non-state and state actors against Palestinians and Israelis. These reports are being investigated, but this certainly wouldn't be the first time that women's bodies have been used as tools of war. We have seen many international human rights organizations, medical associations, and unions demand a ceasefire in Gaza and plead with the Israeli state to stop targeting healthcare workers, facilities, and hospitals. We have seen a movement of Jewish people inside and outside of Israel condemning the Israeli state as a perpetrator of genocide and an instigating force for increased acts of anti-Semitism and Islamophobia worldwide. Why then are so many healthcare providers and organizations still unable to bring themselves to speak out for Palestine? Why has the Association of Ontario Midwives remained silent Oops. Oopsie. Same problem as JD. Why has the Association of Ontario Midwives remained silent as escalating violations of human and reproductive rights have increased since October 7th? Why aren't there more healthcare providers here today or taking to the streets in demonstrations? It is because so many health institutions, associations, and providers exist today as a direct product of racism, colonialism, and patriarchy. Publicly supporting the Palestinian people is a contradiction to the status quo that is propping up the very institutions that we work within. Midwives like to say that this job is inherently political, but it's my feeling that if you're not standing firmly in the corner of the Palestinian people, demanding a total ceasefire right now in Gaza and an end to the legal occupation, I think we have to rethink who is benefiting from the kind of politics we're subscribing to.